Hello everybody, my name is Dr. Sharath Krishnaswamy and I shall talk to you about the effects of smoking. So smoking has various effects on different organ systems, and especially when it comes to surgery and post-operative recovery, patient may take a longer time to recover from anesthesia. So what does smoking do? Most people get together and smoke, or smoke during their pastime, or smoke as a form of recreation, as a method of relaxing and everything else. But however, it can actually affect the different organ systems, including the heart, the blood vessels and the lung. For example, smoke contains soot particles and tar particles that can form a layer upon the alveoli, which is basically air sacs present in the lungs. So this is how the air sacs is a representation of how air sacs are in the lungs. So what smoking can do is it can cause something known as the chronic obstructive pulmonary disease. So basically, for a normal person, a person takes a deep breath, inhalation, and then exhales, and the air sacs completely compress and push out the rest of the air. Whereas in some patients who have this condition called chronic obstructive pulmonary disease, what happens is the air sacs are unable to relax completely and to push out the air present in the lungs. So what happens with the air inside the lungs is there's a greater amount of carbon dioxide that builds up. So the greater amount of carbon dioxide that builds up makes it difficult for the patient to exchange the oxygen with the carbon dioxide, and this can lead to a lot of other systemic effects. So the patient will have to be off smoking for at least 6 weeks before surgery. And the greater the number of days the patient is off smoking before surgery, the better the recovery will be and the easier the patient will breathe post-surgery. So chronic obstructive pulmonary disease can also affect the heart in different ways. So one of the ways it can affect the heart is it can cause increased pressure on the right side of the heart, which supplies the lungs with air. So when there's an increased pressure from the blood vessels leading outside the heart, there can be an increased amount of power that the heart has to pump towards. So once the patient has a failing heart, this can affect the oxygen delivery as well as the post-operative recovery. So of course there are different types of cigarettes that are coming out, but this smoking can cause long-lasting effects and can also affect the healing process. What we as anesthetists are very worried about is during surgery there can be changes in the heart rate and the rhythm of the heart. So this can actually affect the way the blood is being delivered and the oxygen is being delivered to the tissues. What is absolutely necessary for healing and after any surgery is the amount of nourishment the organ systems get, the amount of oxygen delivered to the tissue, and the amount of blood at a constant regular pressure that is being delivered to the tissue. So which is why it is important that a patient who has been smoking for a long time starts exercising, and we advise something known as in-center spirometry, in which a patient can take deep breaths and push out the breaths, which will increase the level of the balls which are there in the spirometer. And you can also do yoga and deep breathing exercises. Anything that will help exercise your lungs is beneficial for you so that you can recover from surgery faster.